I'm John Bell. I'm a community pharmacist by background. I also work for the Pharmaceutical Society in terms of developing consumer education, health education, and staff training, that is pharmacists and pharmacy staff training. I'm also a practitioner teacher at one of the universities in Sydney, the University of Technology Sydney, in the Graduate School of Health. So looking at primary healthcare issues really, how pharmacists would assess people who come in present with certain symptoms. Do they refer, do they treat? What treatments do they use? What counselling do they give? I think conferences, and more particularly the International Pharmaceutical Federation conference, which we've attended just recently, has a tremendous role insofar as sharing information, research data, the latest advances in treatment, the opportunities that we have now, I guess, for more appropriate treatments, particularly of upper respiratory tract infection, where we can reserve and preserve antibiotics for the critical infections and use more appropriate symptomatic treatment. It benefits the patient, of course, but it also benefits the community from a public health point of view. I think it's important for us all to realise that mostly patients want relief from their symptoms, even though doctors might believe the patient wants or is demanding even an antibiotic. Our research has shown that what people want most is relief from symptoms. It's important, I believe, that pharmacy is well positioned to be the first port of call for upper respiratory tract infection management. We have the resources, we have the expertise and the skills. Certainly we need, and GRIP as part of its commitment is enabling us this to occur really, to I suppose make patients aware, to see their pharmacist first. If they have a cough, a cold, the flu, sniffles, sneezes, go to the pharmacist, get that advice in the first instance. The pharmacist is well positioned to treat or to refer. And of course, another aspect of GRIP's role is to upskill the pharmacist, to give the pharmacist the necessary skills. Certainly young pharmacy graduates have those skills. They have them in abundance. But of course, the pharmacy profession is a wide range of ages and of course in different locations, different regions of the world. So we're looking worldwide to make sure all pharmacists have those skills to assess and determine whether referral is required and necessary or whether symptomatic treatment can be provided. So to summarise there, to make sure the patients know the pharmacists are well equipped to advise them, to ensure that the pharmacists are indeed well equipped and skilled, highly skilled, but also to, I guess, make the doctors aware too, not only that symptomatic treatment should be the first choice, but to encourage that collaboration, a collaborative partnership between the medical profession and the pharmacy profession. We know that pharmacists and pharmacy staff have different skills, different expertise from country to country, region to region. The regulatory frameworks are different, their training is different. And this is something that GRIP has taken account of, and we're really working hard to ensure that pharmacists worldwide are very well able to ensure they give the right advice, the most appropriate messages around antibiotic resistance and the very best possible recommendations for symptomatic treatment. I think when patients have an upper respiratory tract infection, and just about every one of us will do at some stage every year, sometimes several times a year, make the pharmacy the first port of call. Check what's available, ask the pharmacist to assess those symptoms, whether referral is required, and if not, what symptomatic treatment is most appropriate. I think that when patients experience upper respiratory tract infections, they should have a realistic expectation of the duration of those symptoms and the likely severity as well. There's no need to rush off to the doctor within 48 hours of experiencing symptoms. But if you do go to the doctor at any stage, articulate clearly what you want. You want relief from symptoms. Don't demand an antibiotic. Don't expect an antibiotic. Talk about the issue with the doctor. More likely than not, now the doctor will say, well, we don't need an antibiotic for you, but this is what we can give you, which will be much more effective. Of course, I think it's more appropriate even to go to the pharmacist in the first instance. Just have that pharmacist assess the symptoms for you. Just check whether referral is required based on the severity of your symptoms, other maybe comorbidities, perhaps other existing conditions you might have. But for most people, certainly the vast majority of otherwise healthy adults, symptomatic treatment based on your symptoms, based on the symptoms that you have, will be the most appropriate treatment for you.